Namaste, good morning, and welcome to Times Health Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. So today, what we are going to talk about is, as the year is ending, okay, as we are coming to the end of 2025, I thought, why not I share with you something that leads to a yogic way of life. Okay, when I say this, we all the year around we have been discussing about a lot of alignment, joint alignment, okay, muscle work, etc. But something that is really important is leading to a yogic way of life. Okay, and which is why this topic for today that we are going to discuss is about yoga and hormonal harmony. Okay, so we are going to see how the hormones in our body are influenced by various factors and why it becomes very, very important to follow a yoga way of life. Okay, which will keep this hormonal harmony in place. Okay, so today we are going to discuss about that, but we are also going to discuss about some of the evidence-based asanas, that is the asanas which are proven in researches to have beneficial effects on the hormonal synchrony of the body. So I'm going to tell you some asana practice which is definitely going to help with the hormonal harmony. But before that, let's just understand some basic aspects of the hormones. So I'll just tell you what exactly is a hormone. It is nothing but a chemical messenger which is released from certain specialized tissue cells, okay, within the bloodstream. It goes on to a target organ and activates or makes the organ work in that process. Okay, so it's kind of a chemical messenger which is released by some specific tissue cells. For example, the thyroid gland, it will release certain specific chemical messengers which are going to act on the body metabolic processes. Okay, so it is going to regulate the body metabolism. Okay, if you see some other hormonal organs, okay, there are something called as the adrenal glands which are located over the kidneys. Okay, they are also going to release some specific corticoid, adrenocorticoid hormones which is going to create a certain it is going to regulate the blood pressure and certain other systems within the body. Okay, then there are some sex hormones which is released by ovaries and the testes. Okay, which is going to work for that specific purpose. So they are all specialized cells, okay, which are going to release some chemical messengers. Okay, and then we have the master of hormones, these glands, which is the pituitary gland, which is going to release certain chemical messengers which are going to go and tell these organs to release the further hormones. Okay, so it's like a master of the other glands, and there is a master of the master which is the hypothalamus. Okay, which is the part of the base of the brain, and it is going to instruct and check whether pituitary is doing the right function or no. So we have got a hierarchy, okay, which is going to control the entire hormonal function within the body. These hormones are very, very important as they are going to regulate some very important functions of our body, and hence regulating hormones becomes very, very important. Okay, I have just named a few important hormones. There are many more to this list. Okay, I'm not going to get into the details of it, but yes, I'm sure you all know there are certain conditions which happen due to alteration of these hormones. Something like hyperthyroidism, when the thyroid hormones are more, okay, altered. Okay, then there is hypothyroidism. Okay, then there is something called as diabetes. Okay, again because of some insulin problems that happen, okay, with the pancreas. So that is also one of the conditions, such conditions which we commonly hear these days. Okay, these conditions are due to hormonal alteration. So you can understand that how important is the hormonal harmony, and which is why I come on to the topic of living the yoga way of life, understanding it better. Okay, because as the hormone creates experiences within our body, so does our experiences leads to hormonal regulation. So it's like a bi-directional loop. Okay, so as your hormones will create some experiences within the body. Okay, for example, if you know, if somebody is having hyperthyroidism, they may feel more heat, they may feel more racing heart rate. Okay, certain changes are there when there is a hyperthyroidism state. Okay, so this kind of response, or this is a kind of experience that we get within the body, and which is why we approach a doctor and ask what is exactly happening with me. And when the blood tests are done, we come to know, okay, this is hyper or hypothyroidism, what exactly is happening. All right, so these kind of experiences the hormones build in our body. Okay, but it's a bi-directional loop. So even whatever we experience is going to influence the hormonal harmony within the body. And now, how will yoga work on this? Okay, so as we know, yoga builds a perspective around life. There are many principles of yoga, there are many theories in yoga which will help in building the perspective around life. So, various life situations which can be stressful otherwise. Okay, maybe after learning more about yogic perspectives, you will be able to deal with those stressful situations in a much better way. There are certain practices in yoga that actually help in calming down our nervous system, and indirectly that way it can influence the hormonal system. Okay, so you understand how important is the yoga way of life. I will tell you about the four pillars of yoga that we generally talk about. If these four pillars are balanced, okay, what will happen is we will have a much better hormonal synchrony and a much better nervous system regulation within the body. So, out of these four pillars, the first one is ahar. Okay, so ahar is nothing but the food that we eat. Okay, so imagine the food that we eat that also creates a certain experience. I'll give you an example. When we eat a lot of spicy food, you might feel a little bit of irritation in the stomach. Okay, there may be a little bit of perspiration or tearing within the eyes also. Okay, so it's creating a kind of a sympathetic response within the body, a spicy food. Okay, so you can imagine it's creating an experience, so it is going to trigger the other chemical reactions accordingly within the body, and which is why food becomes so important whenever we are talking about hormonal harmony. Okay, for example, eating a lot of junk food, fried foodstuffs can build in fats, okay, which are not going to really help with the proper processing within the body. It can increase the inflammation, and that's how it can influence the hormones. So ahar becomes very, very important. Okay, next is vihar. Vihar is nothing but recreation. Okay, so some activity which actually makes you feel good, it elevates your mood, it reduces your stress. Okay, by doing that, it is actually altering the chemical components within the body. So whatever elevates your mood and reduces the stress is also going to change the cortisol hormone. It is also going to change the insulin sensitivity. To everything is linked, okay, to each other. And that's why Bihar becomes equally important. Okay, something, some activity which is going to boost your mood, okay, which is like a stress buster for you. So having one activity like that becomes very, very important. You can choose anything. It could be arts, craft, it could be dancing, it could be anything of your choice, which is going to actually take you away from the stress or maybe make you more effective to deal with stress. So, vihar is the next thing. Another thing is achar, or the conduct that you do, okay, the way you behave. Okay, that is going to also decide how many stressful situations you are going to come across. Okay, or what is your approach towards any kind of a problem or a conflict, how do you resolve it. So that is why certain principles are there in yoga which is going to balance out your ahar, okay, your achar, that is your conduct. Okay, so that is also very, very important, because the way we conduct ourselves, that kind of response we are going to get from the environment and from the other people. Okay, so that is ahar, vihar, achar, and next one is vichar. Vichar is nothing but the thought process that we have. So a similar situation, two people can deal with in a different way. Okay, one person can be really stressed about a particular situation, and another one would be able to deal with it much more effectively. Okay, it's all about a difference in the thought process, in the perception, and which is why your vichar becomes very, very important whenever you're dealing with any kind of situation. So, ahar, vihar, achar, and vichar, all these things become very, very important whenever you are trying to create a harmonious environment for the body. Okay, so I hope you're going to look into these four pillars in your life and try to incorporate as many yogic principles as possible to make a conducive environment for your body, okay, so that it can have that kind of hormonal harmony, all right, and less of hormonal issues you have to face within your life. Okay, so ahar also includes what kind of dincharya you are following. Okay, whether you're sleeping on time, getting up on time, how, what kind of routine you're following. Is it a haphazard routine? Are you changing your routine again and again? Okay, the way we conduct ourselves will decide at what time what chemical is to be released. Our body is very, very sensitive to every information we are giving to it. Okay, so it becomes really important what kind of routine you are following, and which is why this dincharya also becomes important. All right, so that's about the theoretical aspect, and some of the practical applications can be brought about once you start learning more about yoga and the yogic way of life. Now we will go on to the asanas, which are important for building this hormonal harmony, because the primary thing that we always do is discuss about the asanas. So we're going to start with those. These are evidence-based practices. Okay, so I have read a lot of research papers, come across certain things, and then I'm telling you these asanas have been proven to be beneficial in case of building that hormonal synchrony within the body. All right, so let's go on to it. We will start by standing on the mat. Okay, good morning, Asha ji. Good morning, Diya ji. Good morning, Jagdeep ji. Namaste, Neelu ji. All right, so we will start with the warm up. Keep 1 foot distance between your foot. Okay. Before we go on to that, we first start with conditioning. I shouldn't forget that. All right. So you keep your legs together. We will start with Sthit Prarthanasana. Okay. So keep your hands in front of your chest. Join them. Focus at one point in front of you. Now slowly close your eyes and focus on your body and your breath. Try to observe if you feel uncomfortable keeping your eyes closed, you can keep your eyes open. Just calm your mind, bring all your attention to your body. Now, slowly you can relax and release. Okay, we will start with the warm up. 1 foot distance between your feet. Okay, we're going to start with the neck movements. Now, I'm going to take my chin to the chest as much as possible and up as much as possible. So, take it down. 1, 2, 3, 4, 5, 6, 7. Okay, now we turn the neck to either side. So 1, 2, 3, 4, 5, 6, 7. Perfect. Now drop your ear to the shoulder. 1, 2, 3, 4, 5, 6, 7. Okay, now we're going to rotate our shoulders. So keep one hand on your chest and just turn around your shoulder. 1, 2, 3, 4, 5, 6, 7. And other way around. 1, 2, 3, 4, 5, 6, 7. All right, we do it on the other side. 1, 2, 3, 4, 5, 6, 7. And the other way around. 1, 2, 3, 4, 5, 6, 7. All right. Next, we are going to move our wrist. So turn it around. 1, 2, 3, 4, 5, 6, 7. And other way around. 1, 2, 3, 4, 5, 6, 7. Okay, now we're going to do some rotations. So keep one hand on your chest on the opposite side, one hand behind, and turn towards this side. 1. Now change your hand placement and do it on the other side. Okay. 2, 3, 4, 5, 6, 7. Perfect. Okay, now what we are going to do is we are going to lift our hip up. Okay, 1, 2, 3, 4, 5, 6, 7. Perfect. Okay, now we are going to rotate our ankle. 1, 2, 3, 4, 5, 6, 7. And the other side. 1, 2, 3, 4, 5, 6, 7. Okay, so even this warm up that we are doing, it's kind of a preparation of boosting the metabolism to a certain level. Okay, so we're not just going directly from no activity to direct full activity. We are going through a warm up, so we are gradually pushing the body to increase its metabolic activity. Okay, so this is a systematic approach to do things. All right, so this metabolism change can actually influence your thyroid hormones. Okay, so you can understand how important it is to regulate your metabolism as well. All right, now let's go on to first asana, which is talasana. Okay, so we're doing talasana 3. Anybody who has any spinal injury or surgery, okay, please do not do this asana. Any major cardiac ailments or hypertension, okay, please do not perform this particular asana. Even frozen shoulder, okay, you may modify this asana a little bit. Okay, so let's start. Inhaling, we take our hands up from the side. 1, 2, 3, join them up, stretch up, stay there. 2, 3, 4, 5, 6, exhale. 1, 2, 3. Okay, we do this again. Inhale. 1, 2, 3, stay. 2, 3, 4, 5, 6, exhale. 1, 2, 3. Okay, any asana can be repeated about 3 to 5 times comfortably. Okay, let's do it once again. Inhale, fix your gaze at a particular point, stay there. 1, 2, 3, 4, 5, 6, exhale. 1, 2, 3. Okay, fixing your gaze is also so important whenever you are doing any yoga asana. So your eyes should be fixed at a particular point. Okay, it's also going to train your eye muscles, and these are very closely related to your neck muscles. So it's going to create a synchronous activation of all the muscles. Plus, this particular asana, since it's having a lot of elongation component, okay, it's having a lot of core activation as well, because you're balancing on your toes. It's going to create a good posture, okay, which is also going to help in better hormonal secretion and better hormonal harmony. Okay, so we will do this one last time. Inhale. 1, 2, 3, stay there. 2, 3, 4, 5, 6, exhale. 1, 2, 3. All right, so this was about it. Next, we are going to go for Konasana 3, okay, which is you need to take about 2.5 foot distance between your feet. Okay, you keep your hands in front. Inhaling, take your hands to the side. Now turn your head towards the right hand. Exhaling, take your right hand, go to the left foot. Turn your neck upwards. Stay there. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Turn your head to the other side. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So over here, multiple things are happening. We are turning the neck in a particular way. It's also going against gravity. Okay, so it's going to activate a lot of muscles around the neck, which is also going to influence the thyroid and the parathyroid glands. Okay, you're also twisting the abdomen. So again, reproductive organs, the pancreas, everything is getting affected by this. Let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there with normal breathing. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right. This is also increasing the gyan bhav or body awareness, okay, within ourselves. Okay. So it's going to increase the knowledge about your body, where exactly what is happening if you pay attention to it. Okay. Let's do it one last time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So one important point in this particular asana is when we go down, okay, if we are unable to touch the ground, we tend to shift our pelvis and then try to reach because it gets easier. Okay, so what we do is we shift towards one side and then it gets easier to reach the ground, which is not supposed to be done. You're supposed to keep your pelvis in place and then you have to try and reach your opposite toe. Okay, so do not shift your pelvis when you are doing this, though it may become easy to do that. Okay, but we are not supposed to go for the easier way. We are supposed to go for the right way. All right, so this was about Konasana 3. Now let's go on to Hasta Padasana. Okay, so it's a forward bending posture. What we are going to do is keep our legs together. If you have had any hernia or abdominal surgeries, spine surgeries, any major severe spinal problems, hypertension, or any major cardiac ailments, please do not perform this particular asana. All right, so what we are going to do is inhaling, bend a little backwards, exhaling, bend forward, and try to touch the ground. Stay there. 2, 3, 4, 5, 6. Inhaling. Bring your back and hands up to 90 and then come up using your hamstrings and then slowly relax. Okay, so you see the sequence by which I'm coming up. As this is a head low posture, okay, it's going to create a lot of blood flow towards the head. Okay, so towards the upper glands and the glands which are located towards the head. Okay, so now let's do it once again. Now this time we incorporate the bhava of vairagya or surrender, since it's a forward bending posture. Okay, so we are creating a positive environment within the body by doing this particular asana with vairagya bhava. Let's do it again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, so letting go is what we are expecting at the end. Let's do it one last time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. All right, this was about Hasta Padasana. Next, we go on to Trikonasana 1, which is a little bit of alteration. Again, it's a forward bending posture. It's going to activate a lot of your back muscles. Okay, so mechanically, we are stimulating some of the organs in the back area. Okay, so what we do is again keep our legs together. Inhaling, bring our hands to the shoulder level. Exhaling, lean a little forward, keep your back straight and try to go down as much as possible. Point your fingers towards your toes, keep your head up and stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, it's going to create a lot of stretch at your hamstrings and your calf. Okay, plus it's going to activate a lot of muscles of your back since we are putting it against gravity. Okay, let's do it once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, we will do it one more time. Okay, let's do it. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, another, if you want to make it a little more challenging, if this seems easy, you can do Samkonasana, wherein you take your hands up and exhaling, bend forward 90 degrees. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Just to make it a little more challenging, okay, it's going to work on your upper back as well if you do it like this. Okay, next we are going to go for a sumo squat. Okay, so what we are going to do is keep a distance of about 3 foot between our legs. Turn both the feet outside. Okay, now what we are going to do is just flex from both the knees, keeping our back straight, and stay there. 1, 2, 3, 4, 5, 6, and come back. 1, 2, 3. Okay, this is going to create a lot of activation of the pelvic floor muscles as well as the core muscles and a little bit of your glutes, quads. Okay, so all these muscles are going to activate it, creating a better flow of blood towards the abdomen and the reproductive organs as well. Okay, plus it's a powerful pose, so it kind of creates a good sense of power within the body. Okay, but it's very important that you're not flexing your abdomen like this. It's not pointing downwards. Okay, it needs to be straight, and then you need to go down and stay in that position. 1, 2, 3, 4, 5, 6, and come back. 1, 2, 3. All right, so I hope you can see the alignment. Okay, once again, inhale and exhaling, go down. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Okay, once again, we will do this. Inhale and exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. All right, so this was a partial squat. Now we will go for a full squat, that is malasana. Okay, very important for ovarian glands as well as the testes. Okay, so what we do is 3.5 foot distance between our feet. Sorry, 2.5 foot distance between your feet. Okay, not 3.5, 2.5. Turn your foot outside 45 degrees. Inhale and exhaling, squat down completely. Push your elbows out, pushing your knees out. Keep your back straight and stay there. 1, 2, 3, 4, 5, 6. And slowly push yourself up and get up using your inner thigh muscles, lower end of glutes. Okay, use those muscles when you are getting up. All right, we will do this once again. Inhale and exhaling. Go down. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, come up. 1, 2, 3. All right. Use your muscles as much as possible, leg muscles, to push you up. Okay, once again, inhale and exhaling. Go down. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. And relax. Okay, so this was Malasana. Now let's go on to some poses in the sitting position. So I'm going to sit down. All right. Okay, so the first one is a simple Parvatasana. Okay, it looks very simple, but it has got a lot of core activation, pelvic floor activation, plus the blood circulation is directed towards the central side. So it is a very good pose to practice. So you either sit in Sukhasana or Padmasana, whatever is possible. Okay, and now slowly inhaling, take your hands up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Most of the times we keep our hands down and we are sitting with our hands down. Okay, so we tend to slouch. Okay, our neck comes forward and all the changes are there. With this Parvatasana, that becomes much better because you are kind of aligning your spine to the correct position. So it's a very effective pose. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. If you're doing it properly, you will feel some stretch happening in the mid and the lower back as well. Okay. Let's do it once again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, one more time. Inhale. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, so this was Parvatasana. Next, we are going to go for Ushtrasana. Okay, a very important pose because it includes a lot of chest opening. Okay, plus it has a lot of neck control also involved within it. Okay, so what we are going to do is we are going to sit in the kneeling position. You keep your hands behind you, fingers are pointing towards you, and inhaling, push your hips and thighs forward. Stay there. 1, 2, 3, 4, 5, 6, and 1, 2, 3. Okay, so as much as you can try to push your hips and thighs forward. Okay, it's going to create a lot of stretch in the anterior aspect of the body. Okay, plus there is a lot of neck control involved. This time I'm not going to count. Okay, you can count in your mind and do the same pose. Okay, so keep your hands pointing towards you. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, we will do it one more time. This also creates an Aishwarya Bhav since it's a backward bending pose. So it's going to create a lot of self-confidence. Again, a very positive environment for the body. Okay, so it's going to help with the overall better functioning of the body. Okay, let's do it once again. Inhale. 1, 2, 3. Okay, exhaling, you can come back. So this was Ushtrasana. Now we're going to do Balasana. It's also counter pose for Ushtrasana and also a very good pose for, letting go or creating the bhava of vairagya, reducing the stress. So like it says, it's a child's pose. Okay, so we go into Vajrasana, slowly slide our hands and exhaling, go down, relax. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. Mind you, I'm not continuously stretching my hands forward when I am down. I am just leaving my body towards gravity. It's a sense of letting go that we are trying to induce. Okay? So inhale, exhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale and come back. 1, 2, 3. Okay, it's okay if your hips are lifting initially. If you're not able to go down with your hips down, it's fine. Okay, but gradually you have to try to get your hips down onto your ankles. All right, let's do it once again. Inhale, exhale. 1, 2, 3. Stay. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Okay, so this is Balasana. Now let's go on to another one. A very good asana, always mentioned in research papers. Okay, it's the Ardha Matsyendra asana. So you keep both your legs in front of you. Cross your ankle to the other side and bend your knee so that your heel is near your hip. Okay. Now what we do is we raise our hand up, try to interlock, hold your ankle and slowly turn behind and stay there. 1, 2, 3, 4, 5, 6. Slowly come back. Relax. Okay, we do it on the other side. Okay, raise a hand, hold your ankle and twist. Stay there. 1, 2, 3, 4, 5, 6. Inhaling, come back. 1, 2, 3. All right. In case if you feel there is some shoulder pain that is happening when you're trying to hold the ankle, okay, then avoid doing this particular thing. Instead of that, what you can do is you can hold your knee like this and then you can try and turn behind. All right. So, yeah, like this and then turn behind. 1, 2, 3, 4, 5, 6, and slowly come back to the center. All right, we will do it on the other side. 1, 2, 3, 4, 5, 6. Come back to the center. Okay, we will do it one last time. If in case this is also difficult, okay, then what you can do is you can keep one leg straight, you can cross the other leg, and then you can just twist. Okay, so this is also possibility. You can alter the asana as per your identified level and then gradually progress on to perfecting the asana. Okay, so let's do it once again. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly come back. 1, 2, 3. Okay, other side. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Come back. 1, 2, 3. All right. So this was Ardha Matsyendra Asana. Now we do Bhadrasana. Okay. Another beautiful pose. Okay. So you join your feet together. Try to push your knees down and straighten your back and stay in this position for some time. You can close your eyes and just feel the stretch. 1, 2, 3, 4, 5, 6, and slowly relax and release. Okay? We can do it once again. Inhale, straighten your spine and stay there with normal breathing. 2, 3, 4, 5, 6, and slowly relax and release. If you want to improve your flexibility of the inner thighs, you can incorporate a forward bend to this. Okay, so what you can do is you can hold, interlock your fingers, hold, and slowly try to bend forward. Stay there. 1, 2, 3, 4, 5, 6, and come up. Okay, but do not overstretch. Try to go as per your comfort. Okay, do not try to overstretch the muscles. Okay, if this is not possible, forward bend, you can just work on elongating your spine in that position. That's also going to be very effective. All right, next we are going to go for some lying down poses. Okay, so some we can go onto our side and lie down straight on the back. The first one is Setu Bandhasan. Okay, it's also going to target the thyroid and the parathyroid glands. Okay, so inhaling. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Slowly exhale. 1, 2, 3. Repeat it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. And slowly 1, 2, 3. One more time. Inhale, press your feet down as well. Don't just push from your back. Okay, push from your feet as well. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, so this was about the Setu Bandhasan. Next, we are going to go for some inversion postures because normally we are almost always towards gravity. Okay, so we are going to do Sarvangasana, but I'm just going to do 1 rep of it, okay, because it can be risky to do without supervision. So make sure that if you're not confident, do not perform this asana. Okay, I'm just going to show you one variation of it, and then we will do some friendly variations wherein not much risk is involved. Okay, so though it's a beneficial asana, and that is why I'm telling you. Okay, so what you do is raise your legs up and slowly go onto a shoulder stand, push your feet up, stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, but if this is not possible, you can always do legs up variation. So either you can do without support, so you can just lift your legs up and stay there. 1, 2, 3, 4, 5, 6, and slowly down. If this is also not comfortable, you can go towards the wall and put your legs up against the wall. Okay, so just lie down and put your legs up against the wall. Stay there with normal breathing. 1, 2, 3, 4, 5, 6. and slowly relax and release. Okay, you can stay there for a longer period of time, legs up the wall. Okay, we're going to go for some asanas on the abdomen. So we are going to do Dhanurasana, Dhanurvakrasan. You bend your knees, hold your ankles, inhaling, raise up and stay there. 1, 2, 3, 4, 5, 6. And slowly down. Okay, we will do it once again. Bend your knees, hold your ankles, inhale. 1, 2, 3. Stay. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. And you can relax in Makarasana. Toes together, heels apart. Turn your face to one side and just relax. You can slowly turn on one side and get up. Okay, and we are just going to sit in Sukhasana for 1 minute. We will close our eyes and try to calm down. So keep your hands on your thighs. Keep your spine straight. Just observe your breath and try to relax your body as much as possible. Let your breath and your heart rate calm down. Now try to take 5 deep breaths. Inhale, exhale, continue. Once you're done with the 5 deep breaths, slowly you can rub your palms, keep it on your eyes, slowly open your eyes and relax. Okay, so this is the sequence of asanas which can be done for a better hormonal synchrony. But I'll tell you that there is no alternative to medicines. Okay, so it's not that if you have diabetes, you can skip the medicines and only do with asanas. It's very, very important to be on your medical support. Okay, so do not try to alternate it with any other thing. But yes, on a general basis, if you follow the yogic way of life, you will definitely create a more conducive environment for your body. With this, I come to the task of the week, which is you can practice the legs up position that I shared with you every day on a daily basis, just for 3 minutes before you go to sleep. And just try to experience what are the changes you are experiencing. You can click a picture of this and upload it on Instagram and tag Times Health Plus. Also, do follow Times Health Plus on their YouTube and Instagram channels for the more tips and recommendations related to yoga. All right, let's look into one of the questions that is there. So Sarika ji asks, good morning. For how long is practitioner a beginner? Okay, of after how much practice does one become a regular practitioner? So Sarika ji, I don't think there is any timeline for this, okay, to say that you are a beginner or a regular practitioner. Okay, so definitely we don't have a timeline. It's all based on if you just started with the yoga practice, then you may be called a beginner. Okay, but as you are going to practice it in the long run, okay, if you're regularly practicing it, then you may be a regular practitioner. That's what we can say. But I don't think there is any definition of saying that this particular person is a beginner and this is a regular practitioner. Although we do have the curriculums uh, which say that this is a basic yoga teachers training and this is an advanced yoga teachers training based on the different aspects of yoga that we learn. But I don't think there is, at least in my knowledge, I don't think there is any definition for saying that this is a beginner and this is a regular practitioner. All right, but with this, I definitely come on to this, that you keep in yoga, I think we always say you keep learning at every step. Okay, so make sure that you increase your knowledge about yoga, because it is a treasure of knowledge. It's going to give you a lot of information of the better way of living. So it is definitely, I would recommend that we keep learning throughout the process, keep opening the different areas of our brain to understand how this yoga way of living is impacting us. Keep learning more and more about it and keep practicing as much as you can. All right, I'll see you next time in the next year. Okay, with this, we come on to the end. So stay present, move gently, and make sure you take care of yourself. And wishing you all a very happy new year. Thank you and namaste.